Hey, so I think we all have an idea of how Hollywood portrays therapy, but in reality, what is the first session really like? Hi, I'm Kim Long and I'm with Dochas Psychological Services in Spruce Grove, Alberta. Okay, so in reality, the first session is a little bit different than regular sessions just because there's some administrative things that we have to go over. In the first session, you're going to go over informed consent, a payment agreement, and some sort of intake questionnaire. And this is going to be different from clinic to clinic depending on how they choose to practice. So some of us practice more from a medical model, and others of us, it's just different from clinic to clinic. I can't explain all the different ways that people practice, but basically for Dochas Psychological Services, you actually do your intake when you register online because we handle our booking system online. As part of that intake, it covers some of the medical questions that you could probably answer if you were just to hand me a piece of paper. And because of that, that information is important, but it's not necessarily the focus when I first see you, because the focus, I believe, needs to be on your story because you're ready to tell your story. So I don't want to be going over information that you could hand to me on a piece of paper, but it's still important information to have, and so that's why that intake form is there. Once your appointment is booked, generally the practitioner, at least at Dochas, will send out an email to you, and that's a welcome email. And in that email, it kind of covers our location, parking, and the all-important, do we have coffee here, that kind of stuff. But also, we tend to include our informed consent form as well as our payment agreement form. And it's not that we're expecting you to do anything with those forms at that time, because informed consent is a collaborative process, meaning that it is something that it's kind of a negotiation between you and your therapist, even though it doesn't always feel that way. But the reason why we send it out in the email is because sometimes it can be pretty lengthy, and it's a good opportunity for you to be able to go over that information before the first session so that you can think about any questions that you have about it. Because when you come to that first session, at least in my experience, you're nervous and you're worked up and your brain isn't working the way it would normally work with being able to come up with questions on the fly. So I think it's important as part of that collaborative process for you to be able to look over that informed consent before coming in. And then within the formed consent, we cover things like the purpose and nature of therapy. So how do I practice therapy? What are my beliefs about therapy? So that you kind of know, who am I dealing with? We also cover confidentiality. Like if you're going through insurance, what are some of the requirements for that? If you're coming in as a couple, we cover responsibilities of the therapist to both parties. It's Again, in the informed consent, we're covering some really important information so that you can feel protected. That's the point of it, so that you know exactly what you're getting into by agreeing to come and see a therapist. And as a result, we do the informed consent almost immediately in that first session, depending on other factors. Like if you're coming in a crisis and you're really worked up, it's going to be difficult to do the informed consent right away. But just be aware that our college really wants us to get that done. And then the payment agreement covers fees for service, cancellation fees, no-show fees, and also ours has a section where you can fill out your insurance information if you have the opportunity for us to bill a third party so that you aren't paying the entire fee. And generally clinics that do offer direct billing will have that on their payment agreement form. The forms, again, it depends on the clinic, but for us, we are trying to redo the payment agreement and the informed consent form every year. So then in the actual first session, which is what this video is supposed to be about, what it is you come in, and in our clinic you can help yourself to coffee, tea. I love how I looked at the door like, oh, I'm looking at that space. But You can help yourself to coffee, tea, all of those things, and just make yourself at home until someone is there to actually greet you, because we don't have an admin yet. Maybe someday. Anyway, so you just come in, make yourself comfortable, and then I invite you into my office, or whoever invites you into their office, and you complete the forms. You have the required discussion about informed consent, and then you do the actual intake. Now, this is where it definitely differs from clinic to clinic. So in some places it's more formal, and actually in my provisional hours, that's how I started doing it. It was this formal clinical interview. There were certain things that we made sure that we covered, all of that. And in talking with my supervisor about that, I kind of found a style that works a little bit better for me. It's a little bit more relaxed, and I just ask you the story of you, because it will cover the things that happen in a more formal interview, and there isn't that time pressure. So some clinics will do that formal interview, and there are people that are amazingly skilled at that. Other clinics will be more laid back about it, which is kind of how I practice. And there are some things, though, that you have to make sure that you get covered in that first session. And the first one is if there's any suicidality. So your practitioner will probably ask you if you have any suicidal thinking, if there's been any past suicidal history, things like that. And then the other thing that we try to get to in the first session, but it might not be clear at that time, is goal setting. What exactly are you coming to therapy for, and how will you know that you have met that goal, so that you know that therapy has reached its natural end? So yeah, really the first session is about discovering whether or not your practitioner is someone that you can trust and work with. And from my perspective, it's also discovering, do I have the required knowledge and skills to actually be of some benefit to you? And if I don't, and that's where the negotiation comes in. From my perspective, if I don't, or if I'm not the right fit for you, I'm not just going to kick you out and say, okay, too bad for you, back to the drawing board. I will actually at that time try to connect you with somebody that would be a better fit, or has the required skills and knowledge to be of more benefit. So either way, you aren't being left on your own. So really, this is where I would invite you to think about, what is your style? Do you want to work with someone that is a little bit more laid back in that first session, or do you want someone who is a little bit more formal and is a little bit more intense in that first session? Because that may also reflect their therapeutic style, and that will help you know whether or not that therapy or therapist is the best fit for you, for what you need in that moment, and that may change over time. So with all of that said, of course, if you have any questions at all, you can contact me at klong@dochaspsych.com, and otherwise, or you can visit our website, whatever works. And there's tons of resources out there about the first session, so I hope that this was of some assistance. And otherwise, until next time, take care.